The organs of the lower respiratory system include the trachea, the bronchial tree, the lungs, and the pleura and pleural cavity. The trachea is a tube of cartilage and fibromuscular membrane, lined internally by mucosa. It descends from the larynx and divides into the right and left principal bronchi. The trachea is mobile and can alter in length, descending during deep inspiration. The esophagus lies behind the cervical trachea, and recurrent laryngeal nerves ascend near the grooves between the trachea and esophagus. Lateral to the trachea are the paired lobes of the thyroid gland. At the fifth thoracic vertebra, the trachea divides into the right and left primary bronchi. The right main bronchus is wider, shorter, and more vertical. The bronchial tree includes the bronchi, which conduct air into the lungs. They are made of hyaline cartilage, and no gas exchange occurs here. The lining membrane transitions from ciliated pseudostratified columnar to simple squamous epithelium. The left main bronchus divides into 2 lobar bronchi, while the right divides into 3. The right principal bronchus is shorter and more vertical, which is why inhaled foreign bodies often enter it. The right main bronchus gives off the superior lobar bronchus, then enters the right lung. It crosses the pulmonary artery and divides into middle and inferior lobar bronchi. Lobar bronchi divide into tertiary bronchi, supplying bronchopulmonary segments. A bronchopulmonary segment is the smallest functionally independent region of a lung that can be isolated and removed without affecting adjacent areas. Tributaries of the pulmonary vein pass between segments. Each bronchopulmonary segment is shaped like an irregular cone, with the apex at the segmental bronchus origin and the base projecting onto the lung surface. There are usually 10 segments per lung, though several fuse in the left lung, resulting in 8. Segmental bronchi divide into primary and terminal bronchioles, which lead to respiratory bronchioles and alveolar ducts. Bronchioles lack glands or cartilage, and their epithelial cells are more cuboidal. Alveolar sacs are associated with each alveolar duct. The alveolus is the basic anatomical unit for gas exchange in the lung. The lungs are the vital organs of respiration, functioning to oxygenate blood by bringing inspired air close to pulmonary capillaries. Healthy lungs are light, soft, spongy, elastic, and recoil when the thoracic cavity is opened. Lungs are situated on either side of the heart. They are pink at birth, but become darker and mottled in adults due to deposited carbonaceous material. The adult right lung typically weighs more than the left. Lung weight depends on the amount of blood or fluid present, and they are proportionally heavier in men. Each lung has an apex, base, 3 borders, and 2 surfaces. The right lung is divided into 3 lobes by 2 fissures. The left lung is divided into superior and inferior lobes by an oblique fissure. Lobes are subdivided into bronchopulmonary segments. The right lung is vertically shorter than the left due to the liver's position. Bronchopulmonary segments are further subdivided into lobules by incomplete connective tissue walls. These lobules are supplied by bronchioles. The 2 lungs contain approximately 300 million alveoli. The alveolar wall is formed by type 1 pneumocytes for gas exchange and type 2 pneumocytes which produce surfactant, aiding in alveolar expansion. The respiratory membrane, where gas exchange occurs, is very thin. It consists of a thin fluid layer, the alveolar epithelium, and the basement membrane of the alveolar epithelium. Additional components of the respiratory membrane are a thin interstitial space, the basement membrane of the capillary endothelium, and the capillary endothelium itself, composed of simple squamous epithelium. The nose is the first part of the respiratory system. It is involved in respiration by humidifying, warming, filtering, and cleaning the air. It also handles the reception and elimination of secretions. The nose is the organ of smell, allowing for olfaction. It also aids in speech, with the paranasal sinuses acting as resonating chambers. The pharynx, or throat, serves as a passageway for both air and food. Its functions include warming and humidifying air, protection, taste, facilitating hearing, vocalization, and speech. The larynx plays a role in respiration by filtering, humidifying, and warming air. It prevents swallowed material from entering the airway via the epiglottis and vestibular folds. It is also the primary organ of voice production and phonation. In the respiratory bronchioles and alveoli, defense relies on protective cells like lymphocytes and macrophages, as ciliated epithelium and mucus are absent. These cells are essential for defense against microbes in the distal air passages. Warming and humidifying of air continue at this lower level. Inhaling dry or inadequately humidified air can irritate the mucosa and increase the risk of pathogenic microbes. To summarize, the respiratory system is divided into upper and lower parts. The upper organs include the nose, pharynx, and larynx, which function as air passages, filter air, and contribute to voice production. The lower system consists of the trachea, bronchial tree, and the lungs, with the lungs being the main organs of respiration. Here are some questions for evaluation. What is the main organ of respiration? What are the functions of the nose, pharynx, and larynx? These are the references used for this video.